Hello everyone, this is Ray, nurse practitioner who specializes in cardiology. And in today's video, I just wanted to talk a little bit about, again, some more risk factors. I just did another video earlier today about what we call the trifecta: high blood pressure, high cholesterol, and diabetes. But in this video, I wanted to talk to you about probably the strongest risk factor that anecdotally I have seen in my practice over the last few years of working in cardiology is one, unfortunately, that you cannot change. It's what we call a non-modifiable risk factor, and that is family history. If you have someone in your family directly related, mom, dad, siblings. As a matter of fact, that's one of my questions when I interview a patient that's coming in to the hospital complaining of, chest pain. That's the number one reason why we get consulted in the hospital. One of the very first questions I ask them is if anybody in their family, mom, dad, or siblings, has had heart disease. Why? Because we know that that is one of the strongest risk factors of developing heart disease. Unfortunately, it's something that you inherit from your parents. I can't tell you, I actually, before I became a nurse practitioner, I worked in the cath lab and I saw many patients getting heart caths, and I can bet you dollars to donuts that if the patient on my table told me, let's say I have a 45-year-old male, that is coming in with chest pain and he had an abnormal test and we're doing a heart catheterization on him, and he tells me that, older brother had heart disease or just got a stent put in, or dad had heart disease and had a heart attack in his 40s or whatever, chances are that patient is going to get some kind of intervention or is going to have heart disease as well. So something very important to keep in mind, that if you have somebody in your family that has had specifically, especially if it's premature heart disease, make sure that you're seeing your PCPs, make sure that you're getting these tests done. It might save your life if you have those strong risk factors. So in today's video, I just wanted to talk to you specifically about family history and how important it is to determine that and what your risks are. So not saying that it's inevitable, but certainly it's something to keep in mind when you're looking at your standard tests, and hopefully it will help you prevent a heart attack in the future and make sure that you're doing the right things, you're on the right medications if needed, and make sure to get yourself checked. I'll see you in the next video.